is our region's best-known hospital, and this year it's celebrating a special milestone, its 250th birthday.
Addenbrooke's Hospital in Cambridge opened in 1766 with just 20 beds. Now the hospital sees nearly 600,000 outpatients and almost 6,000 babies are born there every year. And thankfully, as Tanya Mercer reports now, medical procedures, well, they've changed beyond all recognition.
Pioneering robotic surgery to remove prostate cancer, one of the UK's first of its kind and something that's revolutionised medical treatment.
The mortality rate was significant, 1 in 4 patients passed away, whereas now the technology has enabled us to treat patients. The mortality rates from this operation is now less than 1 in 1,000.
This is just a small chapter in Addenbrooke's 250 years at the pinnacle of medical research and development. But rewind to the beginning and things were a little different. Today, if you feel unwell or you have an accident, you can walk into Addenbrooke's at any time. But back in 1766, when the hospital first opened, you had to turn up at precisely 11 o'clock on a Monday morning. If you missed that slot, you would have to return a week later and hope that you were well enough to do so. Medical procedures through the years were also fairly painful.
This is originally was an Edwardian wheelchair, but it was converted in the 20s and 30s for when people had their tonsils out. And the instrument they used was this, which is a tonsil guillotine. People would sit in here, they'd only have a local anaesthetic, so this device was added so that they could keep the head still while this contraption came towards them. This is a very grand leeches pot. Leeches have been used in medicine for hundreds of years. And in fact, we still use them today in the hospital to aid healing.
In 1766, Addenbrooke's opened on Trumpington Street with just 20 beds. Over the next few decades, the learning developed, and in 1839, the hospital was recognised as a school of medicine. In 1846, Addenbrooke's used its first general anaesthetic, and 1909 saw radiotherapy begin at the hospital. In 1962, the new site on Hills Road was opened by the Queen. Margaret was a student nurse at the time.
Nursing has changed dramatically. It felt like being in a nunnery. Much discipline. We learned to polish and boil, clean and scrub.
Also at today's celebrations was the surgeon who carried out Europe's first liver transplant here in 1968.
Addenbrooke certainly is an internationally recognised and appreciated hospital. I first came to Addenbrooke's in 1965, and it was really a glorified district general, almost cottage hospital, beginning to grow its wings and fly. Of course, now it's like a city.
Today, Addenbrooke sees nearly 600,000 outpatients every year and is internationally renowned, an impressive achievement to celebrate in this landmark year. Tanya Mercer, ITV1.